Well, I knock on the patient's door. Well, first, before I knock on the door, I would check the chart and I would verify name, date of birth, allergies, and I check for the doctor's order. I'd gather all my equipment. I've got my oral medications that I'm going to be administering. I've got my medicine cups. I would also have gloves and alcohol swabs, and if I had liquid medication to give orally, I would have a syringe. At this point, I would perform my hand hygiene and glove up, and I would prepare my medication. And so when I'm in the medication room, I would keep the door closed and not be on my phone because I would, per policy, do the no interruption zone. And I would arrange my medication for preparation. So I would get my medications out, and then I would check those against the MAR. And to make sure, number one, I would check my dosages, and I would read what's on the MAR for my dosages, and then I would read also the bottle or the container that it comes in, that the medicine comes in, to check for dose, expiration date, if need be, the name of the patient that's on there, and the count if they're in there, and the amount of times per day if the order is on the medicine as well. Then I would prepare my medications one at a time, and my 7 rights of medication administration are right patient, right time, right route, right medication, right dosage, right indication, and right documentation. I would then select the correct medicine, and I would confirm the name of the medicine against the container that it's in and the MAR to make sure they match. Um, I would also utilize my drug book and my reference guide for unfamiliar medicines. So, and then if the doses on the labels do not match what my MAR says or what my doctor's order gives me, then I would do my dosage calculations, and I would triple check my dosage calc before I administer any medicine. Then I would also double check my expiration dates, the return outdated and I would return outdated medication to the pharmacy. Then when I am retrieving a controlled substance, I would check the controlled drug record for the previous count and compare it with how much is already in there. I would compare the counts, and if there's any discrepancies in the counts, I would alert the charge nurse immediately. Then I would double check and verify the patient's name on my medication administration record with the labels that are on the drug. That would be my second check. And then I would log out of Pyxis or any other automated things that I use to obtain my medicines from. Then I would, if I had any time-sensitive medications, I would give those first. So if I had a patient that needed their medication at 8 a.m. per doctor's orders, and I had a patient who just needed their medicine by mouth before a certain time, I would give the one that's due at 8 a.m. before I give the one that's due PRN. Now we're going to skip over. Okay, and so then I would, if I'm preparing a unit dose tablet or capsule, I would compare the packaged item medication with the MAR and then put it into the medication cup without removing the wrapper. If there is a wrapper, if it's in a container, I would open the container and I would not stick my fingers inside. That is a no-no. I would tap it into the cup. I stick it one, then from the top, I do not touch it, but I put it inside of there. At that point, I would, if it was in a package, I would put the package inside of the medication cup so I know what medication it is. Since it is not in a package, it came out of a bottle, so I'm sure which medication it is. I would take a piece of tape and a pen, and I would label the medication and wrap it around the cup so I know. I use a single medication cup for each different tablet or each different medication that I pick. If my medications, also if I need to change the dose or split them in half, I can only, number one, I would check to make sure that My tablet is scored. I can only split a pill that is scored. Also, I have to double check to make sure that the medication can be crushed before crushing it. I cannot crush enteric coatings. Um, then also, if my patient has difficulty swallowing, after I would check to make sure that my medication can be crushed, I would crush the medicine using the pill crushing machine that is offered to me on the med cart, and then I would mix my medication one at a time in with soft foods such as pudding or applesauce, and I would give one medication at a time, not mixed together. If I had a medication that was highly acidic, I would offer my patient a non-fat snack if it's not contraindicated by the patient's condition. Then I would administer the tablets with the patient in a sitting or sideline position. I would offer water to the patient or the patient's preferred liquid to help swallow the medication. As long as it's compatible with the medication, I would double check that beforehand. If I had liquid medication, I would take the bottle and you can push the button.